Hello, my name is Alex So, and today I'll be reviewing a condition called varicoceles for my General Medicine 2 final project. Just quickly, the outline, we'll go ahead and briefly talk about introduction, some of the symptoms, how to diagnose these conditions, treatment process, and then we'll wrap things up with a conclusion. Okay, so varicoceles, they're an abnormal dilation and enlargement of the scrotal venous pampiniform plexus, which drains blood from each testicle. Usually it's a painless condition. The patient will not feel, usually won't feel a thing. And just some general stats, 15% to 20% of all males are affected, but are found in about 40% of infertile males, meaning all the couples that are looking to conceive a child or plan to conceive a child, the males that often have issues with infertility, about 40% of them will have this condition. So believe it or not, it also affects male children. So some of the results in a study was performed, it looked at 4,052 boys, all aged between 2 and 19 years of age. So less than 1% of varicocele conditions were found between the ages of 2 to 10. 7.8% were found in aged 11 to 14 years of age. And then 14.1% of the condition was found in aged 15 to 19 years. One thing to note is that physical exertion during these puberty times, these developmental times for adolescent males, will potentially lead to an aggravation and cause a development of this condition. So someone might be thinking, like, how does this really happen? Unfortunately, there's no concrete answer. There's no precise cause of varicoceles, but generally the thought of it is it's developed through a backup of the venous blood flow in specifically the left testicle. Something that I thought was pretty interesting was that there's 3 theories as far as how it happens. So one, left internal spermatic vein gets caught between superior mesenteric artery and the aorta, causing entrapment and venous compression and vein obstruction. The second thought is failure of anti-reflux valve causing retrograde flow to the testicular vein. Lastly, angulation of the juncture of the left internal spermatic vein and the left renal vein. So let's take a look at left versus right testicle. On the left testicle, 80 to 90% of varicocele conditions are found in the left testicle, which is pretty interesting and pretty shocking. And then another part of that is due to the drainage of the left spermatic vein into the higher resistance left renal vein. Comparatively to the right side, the rare, isolated, right-sided varicocele condition generally suggests the right internal spermatic vein enters the right renal vein. Right-sided varicoceles are discovered with bilateral varicoceles. And oftentimes with these procedures, with these procedures, when one is being operated on to fix the situation or fix the condition, oftentimes physicians and surgeons will note bilateral varicoceles. One is just more present than the other. So some symptoms, some men will present with scrotal discomfort, but like I said, they'll be pretty painless, and for the most part, they're asymptomatic. However, if the condition progresses, you may feel like there's a bag of worms. Stereotypically speaking, you may feel like there's a bag of worms in your scrotum. Sometimes the patients will also describe feeling very heavy in the scrotal area, and then may note some soft lumps around that area. So there's some differential diagnoses. I listed 8 of them. We have the epididymitis, which is inflammation of the epididymis at the back of the testicle that stores and carries sperm. You have hydrocele, which is swelling in the scrotum that occurs when fluid collects in the thin sheath surrounding the testicle. Inguinal hernia occurs when part of the intestine protrudes through a weak spot in the abdominal muscle. Paratesticular tumors, intrascrotal tumors that arise from the epididymis and spermatic cord. Spermatocele, which is a cyst that develops in the epididymis. Testicular tumor, that's related to cancers. Testicular torsion, we know about that one, but the testicle rotates, twisting the spermatic cord, causing a blockage in the scrotum, and that is considered an emergency as well. The last one is having a traumatic event to that area. So the main way to diagnose this condition is having a physical examination. That is the standard diagnostic test for varicoceles. Just because of the fact that all the symptoms are either visual or palpable. And there's different severities of the condition as well. You have 4 of them. One is subclinical, not visible, not palpable. Grade 1, which is palpable varicocele, detected upon Valsalva maneuver, but not visible. You have grade 2, which is palpable varicocele, detected while standing up, also not visible. Grade 3, which is large visible varicoceles while standing up. Some other screening methods, you have a high resolution color flow Doppler ultrasound. This will show the dilation of the vessels. Normal and abnormal veins are 2 to 3 millimeters in diameter. Anything above that, you might want to think or caution on the side of varicocele conditions. Next one, we have thermal imaging, which is a non-invasive, painless, and non-contact technique for evaluation and confirmation of a possible varicocele. Testicular strain elastography still needs more studies to determine benefits, but these are just some of the other methods besides the standard diagnostic testing for physical examination. If that's not available, or if you need more testing to figure out the condition, these are some other options as well. So some treatments. There are no effective medical treatments, unfortunately. The varicocele, if causing pain or discomfort, you can use analgesics, and scrotal support can be used initially. However, you might want to refer to a urologist, and they may come up with a plan to surgically remove the varicocele. Some indications for surgery. There's a few of them that must be met in order to treat the varicoceles. These include 1, palpable varicocele; 2, pain related to varicoceles; 3, couples attempting to conceive and has known infertility. That's key right there. Infertility in male partner with abnormal semen parameters. And lastly, in adolescence, when associated with failure of testicular development and growth. Types of surgeries. The most common approaches are retroperitoneal, abdominal, laparoscopic, infrainguinal, subinguinal below the groin, or intrascrotal. After surgery statistics, 70% of patients saw improved semen parameters, aka meaning the quality of their semen has improved, and 40 to 60% of patients that had the operation had improved conception rates. Improved semen quality shows 3 to 4 months post-operation and become final at 6 months. Some things to note though, there is risks. It can't just all be glory. Things to look out for is you might redevelop varicoceles again. Something that's very common. That is a potential risk. Another thing that we talked about earlier is hydroceles. Then we have hematomas. There's always a risk for infections when doing surgeries. Scrotal tissue injury, and then arterial injury to testes or to the testis, which might lead to a loss of the actual testicle itself. So in conclusion, varicoceles affect the veins attached to the testicles, causing engorgement, and may result in infertility in men. Mostly asymptomatic condition, discovery of varicoceles usually occur by accident or incidentally during physical examinations. Varicoceles are common in both adolescents during puberty and in infertile men. A referral to a urology specialist may be indicated for treatment and management of the condition. There are surgeries that improve outcomes, but there are also risks to getting surgery. However, there's still no exact pathophysiology of varicoceles, and there's not enough current data, available data, that includes a variety of clinical factors to fully understand the epidemiology. So my suggestion would be, let's take a look at the BMI of these patients, these test subjects. Genetic factors all play a part, family history, all these things. There's just not enough data or studies to show an exact pathophysiology of this condition. All right, these are my references. Thank you so much for listening to my review of this condition, and have a great day.